Okay, so my patient is having nausea. They have shortness of breath caused by CHF and some nausea, probably because of some medications they've received, and they've requested Zofran. And so I'm checking the doctor's order, and my patient can have Zofran PRN, so I'm going to go pull Zofran out of the Pyxis. Ready? Okay, I'm going to pull out ondansetron for my patient. My patient can have 4 milligrams every 4 hours, PRN as needed. I have the 4 milligrams drawn up into a vial, and I'm going to go give this IV push. Okay, because my patient's on contact precautions due to a MRSA infection, or testing positive with MRSA, I'm going to don my PPE before I enter the room. Strings. Okay. Good morning, Mr. Johnson. I'm Raine. I'm your student nurse. I understand that you're having some bad nausea, and the doctor has gone ahead and ordered you some Zofran that you can take, and I'm going to bring that in for you. But first, I'm going to check your allergies and your name and date of birth. Could you please state your name and date of birth? And do you have any allergies? Okay, I would provide the patient privacy. Okay, and I would, I've identified the patient, the date of birth, allergies, and my medication is ondansetron 4 milligrams, IV push. I have my saline. IV site is in the left forearm. It's saline locked. I take my swab my hub. I would flush with normal saline. Remove that. Ondansetron 4 milligrams. Given over 2 to 4 minutes. I would have my watch. I would time this for a slow infusion of 2 minutes, making sure there's no infiltration and that the patient's handling it as it's given. Once the medication is given, I would have a fresh saline, swab my hub, clear my IV site so it's saline locked. Make sure that the bandage is on correctly. There's no infiltration. The IV site looks well. But then come over to my patient, ask them how they're feeling, provide their call light, make sure their bed is in a low, safe position, and make sure they don't need anything. And I would exit the room, take off my PPE, wash my hands, and then I would document that 4 milligrams of ondansetron was given to my patient through their IV site in their left forearm, that the IV site looked well, that there was no infiltration, and the patient handled it well.